Another in Africa, Resource Watch is calling for mining communities to receive their fair share of the COVID-19 vaccine. The organization says it's noted reports of increasing numbers of miners testing positive, with fears that the virus could destroy the communities in which they live. Now let's get more on this with the SARW director, this Dr. Claude Kabemba. Thank you so much for joining us, Mr. Kabemba. I mean, the numbers that you are seeing in terms of reports, confirmed cases, and as far as, miners in mining communities are concerned, how many are we looking at so far?
Look, it's very difficult to give the numbers because mining companies are not being very open with people who are infected among their workers. Then when you get a number of workers who live in communities, it starts to tell you how far the virus might have penetrated the communities. And we don't have correct numbers from mining companies. But what we do know is that there is a quite fair number of mining workers who are infected. That gives us the sense of what the level of infection in communities.
Yeah, you're raising your concern that at the same time, when the vaccine does come into South Africa, priority needs to be given to miners as well as the communities they live in, because you're saying that if not, then it will destroy these communities.
Yes, indeed. We are calling for safe and equitable COVID-19 vaccine distribution. You will know that most of these mining communities are affected by mining activities through pollution. Their immune system is already weakened, and we are afraid that COVID-19 will spread much faster in these communities, and they will be far more exposed to death than any other community. So we think that because also much of our wealth, we get it from these minerals, we think that we should provide them with opportunities, in fact, to be among the first to receive COVID-19 vaccines.
Yeah, there have been calls for private sector as well, Dr. Kabemba, to support government in this instance, to subsidize where they can, to donate, to offer resources so that this vaccine not only comes into the country, but it does accommodate, as many South Africans as possible. I mean, what's your call here as far as mining companies are concerned in terms of their contribution to ensuring that this vaccine does come and it is made available to miners and mining workers?
Look, the race to access vaccines globally is quite tight, and we think countries that are wealthy enough, especially European countries, will have their hands on the vaccines. We think the South African government will not have sufficient fund to have the dose that we need for the entire population. And mining companies, this is the time for them to really demonstrate their corporate social responsibility by giving a hand to government to procure sufficient dose for the vaccine. And I think it's a call for private sector to come on board, really to support society, to ensure that everyone, especially the marginalized, in this particular case for mining communities, have access to vaccines.
Yeah. In your observation, and perhaps even in some of the information that you may have gathered, are you satisfied with compliance by mining companies and miners under this level 3 lockdown, where, oftentimes experts say it's also a behavioral issue, that in as much as we're waiting for the vaccine is not a silver bullet to solving our issues with this pandemic. It also boils down to behavior. Are you satisfied with miners as well as mining companies and how they're conducting themselves?
Look, we are concerned that mining companies, despite the fact that they've provided support here and there, they have not really been engaged with mining communities in which their workers live. That's one. Secondly, with education, with providing sanitizers and education. We are also concerned that mining companies are not testing enough their workers. The case recently of mine workers who were supposed to travel back to their countries, neighboring countries in SADC, some tested positive and they were quarantined. But South African mine workers who go back to Eastern Cape were not tested. And that poses a serious concern to us that it shows that there is a negligence because these people go back to Eastern Cape, to other places in the country, go there infected and infect others and come back infected. And that is a serious problem because what we've realized is that for foreign workers, because they need to have a certificate that they've been tested, when they are infected, they are quarantined, they are not allowed to go by mining companies.
Right.
But that does not happen for South African mine workers, and that's very serious concern.
All right, we'll leave our conversation there. Thank you for joining me, Dr. Claude Kabemba, Director of the Southern Africa Resource Watch.